Broadcast is now starting. All attendees are in listen-only mode.
Hello, welcome to GDA's webinar on 2018 Group Health Plans. Thanks for joining. Today, your presenter is Christy Biddy. She is GDA's Medical Insurance Benefits Manager.
Hi, thank you for joining us. We're happy to have you with us today. Again, my name is Christy Biddy. I have been with the Georgia Dental Association since August of 2015, and I manage the health insurance and also Medicare supplements. I have over 30 years experience total, though, in the group health insurance field. Okay, now what we're going to cover today is, I'm sure you've heard of some of the issues going on in the health insurance, so we'll go over some of those articles that you may have seen. We're also going to go over, when comparing your health plan choices, what you should be looking at, and also why choose the GDA over the other carriers, why you should go with us. We will also touch on health savings accounts because one of our plans does qualify for that. And then we will also go over the group health plans that we are offering for 2018. And then also we'll go over some frequently asked questions that we normally get. And then we will also open it up to see if you have any questions that we didn't cover today. Now, one of the things I'm sure you've heard in the news is about some of the carriers pulling out of the individual market, specifically Blue Cross Blue Shield. So we were getting calls from people asking us, well, since Blue Cross is pulling out of the market, who's our carrier going to be next year? Well, they have pulled out of the individual market, not the group health insurance market. So I kind of wanted to touch on that just so people would know what the difference is. In the individual market, you are the only one on your plan, you and any dependents that you may have. So you are your own risk pool, you and your dependents. So you do have to go through underwriting for that. The underwriter looks specifically at your age, gender, where you live, who's on your plan, how many are on your plan, because you are rated on each person on your plan and how old they are. And then your premium is based on all of that. Now, on a group insurance plan, the risk is spread out over the entire group. It is shared among everyone. So it doesn't matter about your age or gender or where you live because, again, it is averaged over the entire group. On our employee and children coverage and also our family coverage, it doesn't matter if you have one child or 10 children. The rate is going to be the same because, again, the risk pool is shared and it is averaged over the entire group. Now, GDA is a group plan. The group is the GDA membership. So that is why you have to be a member of the GDA in order to enroll in the insurance and then also to offer it to your staff if you so choose. Also, because it is group insurance, we have certain rules and regulations that we have to follow that are governed by the Internal Revenue Service and the Department of Labor. One of those being outside of open enrollment, you have to have a qualifying life event to be able to enroll in our insurance. That being loss of other coverage, say like you're insured under your spouse's insurance, the spouse decides to leave their job, you no longer have insurance, that would be a qualifying life event. Birth, death, divorce, and marriage are also qualifying events. So outside of open enrollment, you have to have a qualifying life event to be able to enroll in our insurance. Now, one of the articles I'm sure that you have seen is about how Blue Cross originally, back at the end of the summer, had intended to pull out of the individual market, and again, individual, not the group insurance market, in about 74 of Georgia's 159 counties. So they were planning on doing that, and then they also, for the counties that they remained in, they had put in to raise their rates by some 40%. Well, in the end, Blue Cross ended up applying for an increase of 57.5% with the Georgia Insurance Commissioner. The four carriers that are going to be left in the healthcare exchange for 2018 are Blue Cross Blue Shield. They will generally be in South Georgia. Now, there are some exceptions to that. I'm just talking about generalities, but Blue Cross in South Georgia. Alliant in North Georgia for the metropolitan area, including Fulton County, Cobb County, DeKalb, Clayton. It will be Kaiser Insurance, and then also Ambetter. Ambetter generally deals with your Peach Care insureds and also your Medicaid insureds. Even those carriers who had originally put in for mild, low teens, mid-teens increases, when they were talking about, the president was talking about stopping the subsidies to the insurance, they had planned to raise their rates from 51% on average to 56.7%. Well, after all that being said, the state insurance department did approve all the rate increases that Alliant, Ambetter, Blue Cross, and Kaiser put in for. 51% for Ambetter. Again, Blue Cross got approved. They're 57.5%. And they are citing because the subsidies were no longer going to be offered to the insurance companies. So your average premium increases, just to give you a general idea, in the Georgia marketplace, it could be as high as 57.5%, but the Georgia Dental Association's insurance had an average increase across all three of our plans of only 6.33% for 2018. So it's tremendously less than what you're seeing in the marketplace. Now, when comparing plan choices, which we absolutely recommend that you do because you need to get the best plan at something you're comfortable with for your needs. So when you're looking at comparing the plans, what you should look at are your deductibles. Deductibles are basically anything that you have to pay out of pocket outside of a doctor's office, like inpatient services at a hospital, outpatient services. You have to meet that deductible before the insurance company starts paying their co-insurance. Generally, co-insurance is somewhere between 80% and 70% is generally what you will find on most policies. So once you meet your deductible, that is the portion that that your insurance carrier will pay, and then you're responsible for the difference. Out-of-pocket maximums, once all your covered expenses, including your deductible, copays, your prescription copays, if you have prescription deductible, once you reach that out-of-pocket maximum on covered expenses, your carrier will start paying 100% on covered expenses. So you want to compare those to see what you're possibly going to have to total pay out of pocket. You want to look at your primary care and specialist visit copays. If it's an open access plan, open access means you do not need a referral from your primary care doctor to go see a specialist, and all of ours are open access plans. You want to look at how much the copays are. Again, if you need that referral, if there is a limit on the number of visits with a copay, we have seen a lot of plans recently where you might get 3 visits to your doctor with a copay. After that, you have to meet your deductible and then co-insurance. So you want to look at and see if there's a limit on those. Also, you want to look and see if you have out-of-network coverage. Generally, on your PPO plans and POS plans, you will have out-of-network coverage. On your HMO plans, you do not. You also want to look at your provider network, and I can't stress this enough, because this is what generally your insurance carriers will not advertise on the plans you're looking at, whether it's a broad or narrow network. Now, on narrow networks, where you're going to find your problem is that generally your primary care doctor is going to be in there, but if you need to go see a specialist, that may be limited. Also, if you have inpatient or outpatient services at the hospital where you really don't have a choice on who your provider is, like the doctor, like you have to go in for outpatient surgery, and anesthesiologist that you see, you don't have a choice in that. The radiologist who may read your results, the lab that your tests are sent to. So those are where you're not going to have a choice in, and that on the narrow networks are where you're going to provide. The providers are not in network on that. So be absolutely sure to see what kind of provider network is provided with the plan you're looking at. And then last, you want to look at the drug formularies. They should be able to tell you what or tell you how to look up your drugs to see if any type of maintenance drugs are covered on the formulary that is included with your plan. Now, why choose the GDA? We partner with best-in-class insurance carriers. Our carrier, of course, is Blue Cross Blue Shield for our health insurance, but we also partner with best-in-class carriers on our business lines and also on our personal lines. We also leverage our group power when negotiating our renewal rates every year. We definitely are able to do that with a large group that we have. You also have a tenant staff working solely on your behalf. If you ever have any issues, you can call me and I can definitely try and help you out with that. And then dentists make up our board of directors. They're the one who approve our plans, and so they know exactly what the dentist and the dentist community need in their health coverage. So the GDA plans, why choose us? Well, we offer great plans at very competitive rates. Again, our increase for 2018 is only 6.33% averaged across all three of our plans. Our team shops for you, like I was talking about comparing plans. You don't have to do that with us. We actually do that, get the best plans with the best rates. Again, we leverage the negotiating power of a group. We have a very large group of over 1,000 insureds. So we leverage that for you in renewing the rates. Our rate is also guaranteed for 1 year. You will not have a mid-year increase on that. Our plan year runs from January 1 through December 31st, and that rate is guaranteed for that time. Also, there are no surprise cancellations. I know a lot of people are getting those now, where, especially with Blue Cross, saying their policy's been canceled. They're not offering it anymore. Well, you do not get those kind of cancellations from us. The only reason that we cancel any policy is due to non-payment. That's it. Also on ours, since it's group insurance, there is no medical enrollment questionnaire on there. Just to give you an idea in that, I know under the ACA that all carriers have to cover pre-existing conditions, but on an individual policy, they do ask you those health questions because on an individual policy, again, you have to go through underwriting. Well, one of our insureds a few years back had left the GDA to go with another carrier. Well, she completed her individual application. She had some back issues. She put on there, she even called her doctor and asked her doctor, how should I list this on my enrollment form? And the doctor told her what to put down. That is what she put. Well, she was still having back issues. She was trying to control it with physical therapy. That didn't work. She ended up having to have surgery. Her new carrier told her that they were not going to cover her surgery because she did not disclose enough information on her enrollment form. Also, there is no age banding like on an individual policy. It doesn't matter. Again, it's averaged across the entire group. All of our plans are broad network coverage. It covers the entire state of Georgia, and it even travels with you outside the state of Georgia. We have several insureds who have dependent children who go away to college, and their insurance actually travels with them. They don't have to find another policy for their child in whatever state they go to. Again, there are no referrals to specialists. It is an open access plan. If you want to see a specialist like a dermatologist, you find a network provider, call them up and make an appointment. That's it. You do not need a referral. We also offer optional vision insurance at a very low cost, and we also automatically include $10,000 of term life insurance on the primary insured up to age 65. This is group insurance, so you can offer it to your employees, which we highly recommend. There is no minimum number of enrollees per office, so if just the dentist wants to enroll, that's fine. If they only have one employee that wants to enroll, that is totally fine. And again, you have a very dedicated customer service team where you're not on hold for 2 hours trying to get through to someone. We give you prompt attention and try and handle any issues for you that you may have. Now, to go over our plans, just to give you a general idea on all of them, they're all with Blue Cross Blue Shield. They're all point of service plans, meaning you have in-network, out-of-network coverage. Again, they're all open access plans, meaning you do not need that referral from your primary care doctor to go see a specialist. And they all use the same provider network, and it is a broad network all across the state of Georgia. Now, the rates that you see on these sheets, those are the monthly rates. You see one column without the vision and then the other column with the vision. We have 4 tiers of coverage, just the employee only, the employee and spouse, the employee and children. And again, that doesn't matter whether it's 1 child or 10 children. That rate is the same because it's averaged across that group. And also family coverage. Family coverage is 2 adults and then again children regardless of the number. On our POS 500 plan, it has a very low deductible. This is almost unheard of in today's market with a $500 individual deductible. Your maximum out of pocket is $4,400. The co-insurance on this is 80%. Physician co-pays are $25 for primary care, $50 to a specialist. And then on the prescription drugs, there is no separate deductible for that. You only have co-pays on that. You do not have to meet a separate deductible. And again, anything that you're paying out of pocket, including the co-pays on your prescriptions, goes towards your maximum out of pocket on covered expenses. Our next plan is our POS 2500 plan. This is the plan that we have the highest enrollment in. This is our most common plan. This is the plan that you're going to find kind of out there in the general market. So again, this is the one that we have the highest enrollment in. The deductible is $2,500 for an individual. The maximum out of pocket is $7,150. The co-insurance is 70%. The physician co-pays are $30 to primary care, $60 to a specialist. And on this plan, you do have a separate deductible for the prescriptions. It is $200 for an individual, except on Tier 1. On the Tier 1 drugs, you only have a copay, the $15 copay. On Tiers 2, 3, and 4, you have to meet the deductible. Once you meet the deductible, then you go into the copay situation. And our last plan is our high deductible health plan, the HDHP. This is the one that qualifies for an HSA account. You have a $5,000 individual deductible, maximum out of pocket of $6,550. The co-insurance is 80%. And on this plan, the reason it qualifies for a health savings account is then, other than preventive care, now as long as your provider codes it as preventive when they send it over to Blue Cross, it will be covered at 100%. There is no copay, co-insurance, or anything. Like when you go for your annual physical to the doctor and it's coded as preventive, that will be covered at 100%. But on any other services on this plan, you have to meet your deductible before Blue Cross will start paying anything. And again, that is what qualifies it for that health savings account. And again, the rates that you see listed on the sheets are the monthly rates. Now, because our high deductible health plan qualifies for a health savings account, I thought I would go over that and just give you a little information on it. So to be able to set up a health savings account, and you can do that at the institution of your choice. You do not set that up through us. You can set it up through your bank or credit union or wherever you choose, but you have to be enrolled in a qualifying plan to be able to set that up and make deposits into it. It is pre-tax savings. If your employer does not do a pre-tax deduction from your paycheck, it is a line item on the tax return every year. You can see it on there. It's a totally separate line. It says HSA contribution. So whatever you put into your account would be where you would list that money. So you do get the pre-tax savings on that. You can contribute into that account up to age 65. You have to make withdrawals from the account for qualified health expenses, which include your co-pays, your deductibles, your co-insurance. So up to age 65, those withdrawals have to be made for qualified health expenses. Now, when you turn 65, you can no longer deposit money into that account, but at the same time, you can make withdrawals from it for any reason whatsoever. The funds automatically roll over to the next calendar year. You never lose that money. and say like you enroll in the high deductible health plan for 2018, you want to go back to a more traditional plan for 2019, you can still use that money in your account. You never lose it. You just will not be able to deposit money into that account anymore because you would not be enrolled in a qualifying plan. Now, there are contribution limits on this since you do get the pre-tax savings. Those are set by the IRS every year. Generally, they do increase, generally only about $50 each year. So for 2018, the contribution limits for an individual are $3,450. For a family, it's $6,900. And if you're going to be age 55 by the end of December 2018, you can contribute an additional $1,000. Now, those are the maximum amounts you can put in each year. You do not have to put that much into the account. You don't even have to set up the account if you don't want to. It's up to your discretion if you want to. And you can put $5 in there, $100, but that's just the maximum allowable that you can put in there for 2018. Now, we also offer an optional Blueview Vision coverage. You get in-network and out-of-network coverage. This has nothing to do. You do not have to meet your medical deductible in order to get the benefits on this. So if you're, say, like in the high deductible health plan, you do not have to meet that $5,000 deductible before you start getting these benefits. If you go to an in-network provider, and in-network providers are your more popular vision places like 1-800-CONTACTS, LensCrafters, Sears Optical, Target Optical, JCPenney Optical, and most of your Pearl Vision locations. Those are your in-network providers. When you go see an optometrist, and generally optometrists are the ones located in the vision places, you only have a $10 copay. That's it. Now, say like you don't want to go to them, you have your own glass place you want to go to, so you go out of network, and then it turns into a reimbursement program. You would pay whatever the fee is, submit the reimbursement form to Blue Cross, and then you would get up to, say like if you saw an optometrist that is not in network, you would get reimbursed up to $48. So for in-network, it is a discounted program. You can see what the allowables and copays are there, and on an out of network, it will show you up to the maximum on what you can be reimbursed. Now, the cost for this, the premium for this is very, very low. For an individual, it's $5.86 per month, for a total of a little over $70 for the year. Well, if you go see, let's say you go out of network, you get up to $48 back for your eye exam, you get $64 for your eyeglass frames, and say on a single vision lenses, you get $36. That's $148 right there that you're going to be reimbursed, and the premium only has cost you $70 for the year. So for anyone in eyeglasses or contacts, I definitely recommend the optional vision insurance. Now, some of the frequently asked questions that we get, we're going to try and cover here. Are any plans HSA compatible? Yes, it is our POSHDHP, which stands for High Deductible Health Plan. How can I check to see if my provider is in network? You can go to our website, which is gdaplus.com/health. And we have Find a Provider link right there. The network, Blue Cross has about 15 different provider networks. So the one that you want to look in is the Blue Open Access POS network. We also have the drug formularies listed there. So if you want to go and see if your maintenance drugs are covered, it is by plan. So just pick which plan you're interested in looking at, and then click on the formulary. You will enter your drug name and the strength, and it will tell you if it is covered and at what tier on there. So again, our website, gdaplus.com/health. Does a dentist need to be a GDA member? Yes, he does. He or she does. And the reason being, again, it's group insurance, and the group is the GDA membership. Can dental practice employees enroll even if the dentist is not enrolled? Yes, they can. The dentist has to offer it to the staff for them to be able to enroll. And we highly encourage the dentist to do this because there would be no cost to the dentist as long as they have less than 50 employees. So as long as you have less than 50, you can offer it to them. You do not have to subsidize the premium either. You can require them to pay the full amount monthly. And you don't even have to set up a payroll deduction for that. You can have the employee or employees write a personal check and send that to us directly. So there would be no cost to you. There would be no additional administrative work for you to allow your employees to do that. Again, there is no minimum number of employees that need to enroll. You can have just one. The dentist does not have to participate, again, to offer it to the employees. And again, as long as you have less than 50 employees, you don't have to subsidize the premiums. Now, must a dentist offer the health plans to the employees? No, you don't have to unless you have more than 50. But if you do offer it to your employees, you have to be consistent in the way you do it. You can't pick and choose who you offer the insurance to. If you offer it to one full-time employee, you have to offer it to all full-time employees. It is also up to your discretion if you want to offer it to part-time employees. But again, if you offer it to one part-time employee who is working 20 hours a week, you need to offer it to all employees who are working at least 20 hours a week. The same if you decide to subsidize it. If you just subsidize it for one employee for a set percentage or dollar amount, to be consistent, you need to do that for all employees that are on the insurance. And lastly, how is the billing handled? The billing goes out sometime between the 15th and 25th of every month for the following month's premium. It will go to the office. The office will receive one statement. On the statement, each person that is enrolled in the office will be itemized down at the bottom with their monthly premium on there. So the dentist would be able to see all his employees that are enrolled and also the amount that each employee would owe. And again, the dentist can definitely ask the employees to write personal checks. He can collect those, or he or she can actually just have them mail them directly to us. That's fine. We want to make this as administratively easy on the dentist and the dentist office as possible. Now, lastly, our open enrollment ends on Friday, December 1st. That is the last day that you have to return your enrollment form. If you are already insured with us, you do not need to complete an enrollment form unless you are making changes to it. Changes would be if you currently have vision and you want to drop it, or if you don't have vision and want to add it, if you're adding dependents, canceling coverage for dependents, if you're in the high deductible health plan and you want to change to the POS 2500, any changes like that, you do need to complete the enrollment form. The enrollment form can be found on our website, which is gdaplus.com/health. All new people, since we do not already have your information and don't have you in our system, all new insureds will need to complete the enrollment form. It is a very simple form with just your information at the top, which plan you want to be in. If you want the vision, you put a check mark there, and then who is being insured. You, spouse, any children. Under Part 3 of the enrollment form is where you would list that information and sign it and date it. Again, there is no health questions on there. Since this is group insurance, it's guarantee issue. So once you complete the enrollment form and send it in, your coverage will be effective January 1, 2018. There is no approval process. You will automatically be covered as of January 1. Now, once you complete the application, you can either fax it to 404-634-6099, or you can email it directly to me at christy@gadental.org, or you can send it regular mail. If you fax it or email it, I do not need the original. The copy, just the faxed or email copy is fine. So again, my email is christy@gadental.org, or the fax number is 404-634-6099. Also, if you go over to our website, we will have more information listed there. And again, it's gdaplus.com/health. All of our plans will be listed there. We give you a little more information on the exact coverages of the plans, our summary of benefits and coverage. It will go over more in depth on how many physical therapy appointments you can get per year. So it goes over into more detailed information like that. We also have the Find a Provider link over there so you can look up your doctors. We have the vision coverage listed there also. We have the formularies for the drugs listed there. We also have a FAQ document that answers hopefully most of your questions. But again, if you, I think we'll open it up now and see if anyone has any questions. And just so you know, our webinar recording, in case you want to go back and listen to it again, or you have other people in your office or any colleagues or anyone else, we will have the webinar recording on our website that you will be able to go back and listen to. Okay, yay. Hopefully I answered most people's questions because we don't have any right now. But if you have questions that are specific to you that you don't want to ask right now, maybe specific to your situation, please definitely give me a call and I will be happy to answer those for you. And lastly, again, just remember, we give you up until December 1st, we give you plenty of time to look around, see what your choices are, and if you decide to enroll with us, which we definitely hope you do, you have until Friday, December 1st to get your enrollment form back in. Thank you, and I hope you have a great rest of the afternoon. Bye-bye.